side, and
low back pain right side.
Yeah, like
Okay.
by my pelvis, and I've been getting like numbing, tingling, burning pains going down my leg.
Okay.
And then from there, it developed into my neck. I've been having like grinding, weird popping in my neck, and
Okay.
a lot of pain, just strain on my neck.
Grinding, popping in the neck.
Yeah.
Top of the neck, middle of the neck, bottom of the neck.
Middle of the neck,
Okay.
closer to my traps.
Okay.
And then from there, I threw out my thoracic spine
Okay.
not too long ago.
How are you doing all this? What's going on?
I don't know.
So tell me about what happened here with this, with the back and the leg.
With my back, it started, I was weightlifting at the time, going to college, all that fun stuff.
Okay.
And I kind of wasn't eating properly towards the end of it, and like sleeping, stressing with school and all that. And I went to do a deadlift, and I heard a lot of pop. Like, I didn't feel much, I just heard a lot of pop.
A lot of weight or a little weight?
It was like 150, 160, something
Okay.
like that. And I heard it, and I'm like, okay, not too bad. 2 weeks later, I was leaning for a bite of food, and throughout my back, I couldn't walk for like 3 or 4 days. And then I just got MRIs and stuff. He said, my doctor said it's
You
just
did
muscle.
what, sorry?
Got MRIs.
You got MRIs
Yeah,
done?
and
Did they find anything?
He just said it's muscle spasms.
Okay.
So that's all he left it at. And then from there, it just started popping up at random places in my body. And now the most recent one is like my rib, right behind my right shoulder blade. Like I can feel it when I move my shoulder blade, and it's shooting like a pain down, like a numbing and tingling down my ring finger and pinky finger.
Okay, so it started deadlift 3 years ago.
Yeah.
Okay, you heard a pop a week later, 2 weeks later.
Right then when I was deadlifting.
You did hear the pop.
Yeah,
then,
but I didn't.
You didn't feel anything until a couple weeks later.
A couple weeks later when I was just
bending over
leaning,
to do
yeah,
something.
Yeah.
Okay, so you were leaning over to get something, and you couldn't sit back up. It froze. It
I just
stiffened up.
Yeah, I just stiffened up, and I literally couldn't walk. Like
Okay.
I had to be like carried to.
And it's a common thing with it can be a common thing with. I've had that before as well, by
Right.
the way.
Yeah.
But usually it happened where I couldn't go up right away.
Right.
And same thing in college.
Yeah.
No joke. It's a college thing.
Yeah.
Okay, so that was first.
Yeah.
What did you do for it?
For that, I just iced ibuprofen.
You got MRIs, so you didn't go to ER, you went to your doc?
Yeah, I just went to the hospital, got
Okay.
MRIs, went to my doc, and he said
Okay.
that it's just muscle spasms. And then a month later, I went back to him and said it's getting worse, it doesn't feel like muscle spasms. And he said, okay, that's all it is.
But MRI, they didn't find anything?
From what he saw, no, he couldn't find anything.
Oh, okay. Then what happened? So how long before the next situation happened?
I want to say maybe 5-6 months until I
Okay.
started feeling something in my neck. And I do this weird, it's a bad habit. It's probably I'm, enabling it a little more. I do this weird like twitch to get that satisfying pop in my lower back.
Okay.
And that might be something, and I like constantly just pop my neck.
Are you trying to go like this to the
Yeah,
hand
I'll
range?
do this and I'll just like.
That's
try to
but you're
pop,
not doing this?
I do that a lot.
Okay.
And
So
very forceful.
That's an issue. That's
Yeah.
what we need to talk about that.
And then from there, what's giving me the most issues right now is right behind my shoulder blade, and it's just shooting like pain down my arm, and it's meddling with my day to day.
Okay, so number one, let's talk about top three there.
Mhm.
Number one would be
Lower back.
low back is number one.
Yeah.
Number two would be
From behind the shoulder.
the rib,
Yeah.
behind the shoulder blade.
Yeah.
And you're feeling it shoot from behind the arm into these
Yeah.
fingers?
Yeah. Right here.
You're not feeling it coming down the front at all.
No.
You're not feeling it in the forearm.
No.
You just feel it right in there.
Yeah, and it got bad to the point where the pain was going to my sternum just about a few weeks ago before I booked the appointment. That's what made me book the appointment. I felt the
Okay,
pain in my
right
sternum.
side,
Yeah, right side.
not left side.
No.
Okay, cool.
So I knew it's not a heart attack, no.
Okay, good.
Yeah.
All right, what else? Number three
And
is the neck
Yeah,
grinding.
for sure, the neck.
Pain or just uncomfortable?
Pain
Right.
and grinding.
Pain meaning what? You wake up with it, it's stiff,
I
it's
wake
tight?
up, it's very stiff and tight.
Okay.
Throughout the day, my mobility, it takes a while for my mobility to come about.
Okay.
And just constant burning, and just like it just feels fatigued. Like everything in my body right now feels fatigued. It's been messing with me.
So you haven't seen anyone for this? You've been
I've
to
been-
a chiro?
I've been going to a
doctor?
chiropractor, yeah. I'm back in Portugal. I've been going to a chiropractor for almost 2 years now.
Okay.
Because I tried physical therapy, I've tried a couple of chiropractors, but this one I've been like because it's been sort of like maintaining the pain, not really making it better,
Okay.
but just maintaining it, you know.
All right. So it's maintaining wherever you were at a couple of years ago.
Yeah.
It's not
I
getting...
mean, from where I was 3 years ago, it's gotten a bit better, but I mean, progressively it's just been getting worse.
So didn't you see whoever you were seeing for this and tell them this is what's happening? You're getting
Yeah,
this, you're getting
he's
this.
just been targeting it like regular, just
Did they take x-rays?
yeah.
Okay, what did they tell you was your issue?
They just told me come in and keep getting adjustments. That's it, pretty much. They've been telling me I just have like less disc, like the discs in
The
between
space.
the space is shrinking in my neck.
Where did they
and
tell you that was?
They just told me I
In
forget
your neck
which,
or your...
both the neck and lower lumbar. Yeah. So
Let's walk.
okay.
So the first thing I want you to see is right here. Let's look at his dimples. And the first thing we can see is the right dimple is higher than the left dimple. When you look at his spine, he's got the curve in through here. Okay, we can see a little bit of winging on this right side. It's kind of flared out a little bit here. But you see how you can see this line all the way, but then what happens here? It kind of stops. And just looking at it, you can see this whole area is puffy. Okay, so the question is what's causing it? Now, dimple is higher on the right than on the left. March in place first for me. Go ahead and close your eyes, slow it down. Watch his feet now. If you look at his feet, both of them flare out like this. So if you watch his feet, you can see they kind of both flare out. And when he walks, we're going to see if one flares out more than the other, or is that coming from somewhere else. Now, stop for a second, take a step to the right, take a half step left. You went too far, right there. Okay, go ahead and march in place, and let's start over here, right behind him, and let's look at the feet. And as he's marching, the right side goes out more, okay? The right side goes out more. Now let's look at the dimples back over here. This one's not really moving, the right side. The left one's moving a little bit, but this whole area is puffy as he's marching in place. Go ahead and march in place. Let's continue. So again, we start from the bottom. He's got a right external foot flare, which is the major. As we go up his spine, we can see this area is puffy. As he goes up, we can see that the shoulders are a little bit off. But here's what we need to check out if there's an upper cervical involvement. Close your eyes. So as he has his eyes closed, my hands are here, you can see what he's doing, right? What he's doing is he's going more and more forward away from me. Stop. Come back here. Come back one more step. You can open your eyes. Okay. March in place again. Close your eyes, keep marching. Okay, you see he starts to get away from me there. Now, nod your head up and down.
While marching.
Yep, while marching, nod up, all the way down. All the way up, all the way down. Keep your eyes closed, keep nodding, stop marching, and just keep nodding. And with your eyes closed, I want you to stop to where you feel you're with the horizon of the floor. And now go ahead and open your eyes. So what you can see here, it's higher on the right side. If you look at the ears, not you. Come on, dude.
Sorry.
So it's higher on the right side and it goes away. Okay? His right ear looks actually bigger than his left ear, but it's not. Or maybe it is. Who knows? Let's see. And first thing is, let's look at the visual, like we said. It may be bigger, dude. It actually may be bigger.
All right. Ow.
I'm just getting an overall feel. All right, let's run the meter on his spine. Let's see what we find. And we're going to start at the base of the neck. We're going to start at the base of the neck, and let's make sure. What do we see? Start at the base of the neck, and let's see.
The meter's the fun part.
Is it?
Well, for me.
Some people. A lot of people are just coming here for an answer, you know? All right, so first thing we're getting a 14, 15 point break. It's actually happening around the third cervical. Starting around the third cervical. Now it's going to 10. That thing we're seeing up here could just be compensatory to whatever's happening down below. Now, you said low back, you said neck, you said rib behind the right shoulder blade. Now, when we're dealing with ribs, the issue with ribs is the ribs attached to the vertebrae, right?
Right.
And usually when the rib comes out, I haven't actually spoken about this. No one's really asked about how does the rib pop out. Mm-hmm. And it's predisposed from a lot of rotation of that vertebrae. And I'm going to show you on the spine model in a minute. First thing is, let's figure out. All right, so we're getting a reading around T7, T6, T7. Okay. So we have around C3, C4, T6, T7. Get another one here. Nope. Keeps going, keeps going, keeps going, keeps going, keeps going. Interesting. Let's do that again. So we are getting that T67, then right about here, that washed out. So it looks like it's going to stop at 5. It's down low in the sacrum. A lot of this is compensatory, by the way. So we're getting it down at S1, S2, T6, T7, and then we're getting it around C3, C4. Those are where we're getting the breaks, okay? Let's go ahead and statically palpate. Scoot back for me, please. Now, what does that mean? They teach us that the scope can be off 2, 3, 4 segments realistically, okay? The idea, what it tells us is that it's in that general area. And people say, well, you know, there's no reason. I'm going to address certain things that people have been asking, if you don't mind.
No.
And I think it's important. It's important for you to understand. It's important for everyone else to understand. So the first thing is there's no reliability in the scope is what we hear a lot of comments. And everyone is citing a study from the 90s, okay? Part of this is an art. And the way it was taught to me is this scope is an extension of my index finger. Mm-hmm. It's an art, and each scope has a different characteristic. When I say each scope, I mean each type of scope, right? I'm using one that doesn't have a battery. There's no amplification. Mm-hmm. When we get a break, we get a break. Right. Okay. Now, even the ones that do have amplification, the sensors, everyone uses a different type of sensor. But the whole point of it is it's an art, okay? There's a lot of science behind it, yes. But when I'm looking at it and I'm running the meter, is that telling me realistically that's it? It's telling me realistically it's in that general area. Right. And as you get more proficient in the method, it starts to tell you a lot more. It gives you a lot of other characteristic behaviors of how this nervous system or how the body, the skin that's covering the spine is responding to areas of inflammation or instability. They're very specific characteristics. But that's as you go deeper and deeper, you know, into the work. Head down, please. Good. So feeling this, there's a lot of imbalance going on in your body, right? And you already knew that. Okay. So starting here, and we got a lot of dry skin here. You're flaking on me. Yeah. Come on, dude.
Lotion, man. Sorry.
Come on, dude. Here, 7, 1, 2, 3, 4, 5, 6, 7 more tender. 8, not 8. 7 or 6. 7, right there. That's T6. 1, 2, 3, 4, 5, 6. 6, 9, 10, 11, 12. Nope, that's fine. Next, let's scoot forward, please. Feet together. I want you to open and close the knees. I want you to focus on my thumbs here. And let's look at the thumbs. All right, let's start by doing the right side only. And when he does that, it's pulling the skin, but the joint is still independent on the left side, okay? So because of this IN side of the ilium, you can see the skin being pulled, but the joint is not being pulled. Do the left side only. Now, when he does that, the whole thing is shifting. Do you feel that?
Yeah.
Okay. So this right side is the stuck joint versus the left in terms of general motion. Scoot back for me, please. A little more. Good. And now what we're going to do is let's test top of the joint here, top of the joint, middle of the joint, bottom of the joint. More tender right there. Here or here? I'm feeling it here.
Yeah.
Right there.
Yeah.
Let's go on the left side. Yeah, that side moves fine. You feel that? No, meaning it's moving.
Oh, yeah,
it's moving.
Yeah.
Top of the joint, middle of the joint, bottom of the joint. This side, top of the joint, middle of the joint, bottom of right there.
Yeah.
Right side. Scoot back for me. Okay. Right pelvis. Let's check motion this way. Back slowly.
And I've noticed with my right hip, I do have a lot more restriction compared to my left. Ow.
Correct.
Ow.
I'll explain all that right there.
Ow.
So you have sacrum
Oh.
issue and you have a pelvis issue.
Mm-hmm.
That's 5, 4, 3, 2. Tender in there?
Yeah.
A lot of this is compensatory though, the way it feels like. There's a sacrum issue around S2.
Ow.
There's a right pelvis issue, T6. Let's check the neck. Sit back for me, please. Is any of this sounding familiar from what you had?
Yes.
Yes?
Yeah. Oh, some of it, yeah.
So the question is then, what were you getting adjusted? So that's 6, 5, 4. Head down. So there was no real specific segments that were being adjusted?
There were, just I'm sorry, off the top of my head, I can't remember exactly which
That's
vertebrae you had
C2.
mentioned.
Head down. Well, that's another issue, okay?
Yeah.
I think we all need to understand something.
Right.
And what we need to understand is when you're going and people, chiropractors are working on your body, you kind of need to know what's happening. You know, yes, you put a lot of trust and faith in the doctor, but you as an individual should take some not you personally,
Right.
but generally people need to take a little responsibility. Even patients, Gonstead patients, when they come in from other Gonstead doctors, and I'm like, so what do you get adjusted? Sacrum. What's your listing? I don't know. C2, C3, head down, C3, C4, C5, C6, C7. Now, there's a lot of instability up in your neck. It's that cracking. Let me do general circumduction. So as we're going through this, it's a kind of a grindy feel. That scapula is off, the elbow. He's shaking a little bit when I do that.
Yeah, I forgot to mention too, a lot of pain is in the right shoulder too.
So there's a lot of also instability. So that scapula, that whole shoulder complex is off. We're going to check that. This is smooth. That one's good.
All right.
We're good.
1 for 2.
Let's go on your back. Not so bad. I'll show you more when I have him go face down, but we can see this side is a little bit higher. This side is lower, okay? Because we want to do a leg check on him also and see. Why don't we actually do that next? Let's do the Gonstead leg check, go face down. So we have the Gonstead leg check is one of the things we can use. We said that if we look at his heels, the right side is just a tiny bit. You can see if we leave them here, the angles, look at my finger, look at the angles of the heels, they're off. Now, if we straighten it out, they're even, they're just about even. The right side is a tad bit longer, if we look from the top. Now, when we bend it, it stays a little bit longer. And it's so subtle, it's just a couple of millimeters. But that's enough. We are going to start on your pelvis, by the way, okay? Your right pelvis. That's where we're going to start. Tender in there?
Yeah. Oh, yeah.
Tender in there?
Mm-hmm.
All right, let's go flip onto your back again. Tender there?
Oh, yeah.
Tender there?
Mm-hmm.
More here, though.
Oh, yeah.
Okay, slide down a little bit. Now, let's check his talus motion. So, on the outside is moving fine. Inside, a little more stuck, restricted on that medial side. This side is actually moving better. You sprained this ankle at some point. All right. Now, let's go ahead and test the knee. Stand your back, please. Thank you. Relax there. We're doing valgus varus stress. Okay, pop out a little bit on that outside, lateral side with a little bit of bulging on the lateral capsule, lateral meniscal capsule. Slide over towards me on this side. Yeah, that one right there.
Oh.
So we have lateral wedging of the knee, lateral wedging. Medial side is good when we're doing valgus varus stress. Lateral wedging, lateral gapping, and a nice big bulge on that lateral capsule. So we have that, we have the talus. So this whole thing has been affected.
Right.
But it's starting on your right pelvis.
Right.
Okay? Right pelvis, S2. Right pelvis, S2. Post PEX tibia, AS talus, medial tilt. T6 and C3. But I'm suspect about C3.
Okay.
And the reason I'm suspect about it is because you crackle a lot. You crack your neck a lot.
Right.
So I'm going to go to the film. Let's go back in the chair. Let's take a look. Have a seat. Let me test out something. Center up on the chair. Scoot to the right. And I want to test out C7, C6. Yeah. Let me rescope something. I think I missed something. Head down. So you can see we are getting that reading up top there. But let's go further down and see. There's got to be something hiding in there. There it is. It's starting at C7. Head down, please. You start with C7 as a PLS, feet out, resting on your heels, please. Palms up, resting on your thighs. Good. Nice and easy. Good. Perfect.
All right.
So, 1, 2, 3, 4, 5, 6. 6. Home run. Nice.
Oh, that one for sure.
ASEX though, his is AS major. AS major, I'm gonna push it.
Okay.
EX major, we pull it. Slide forward, up on your shoulder. There you go. Look straight ahead. There you go. So ASEX, it's gone anterior superior, externally rotated. We want to bring it down and in. We're going to be down by the ischial spine. Let me do the work. It's this, this. Okay, nice and easy. This. Ooh, gotcha. Home run. Walk it up.
Home run. There we go.
Walk it up. first scope and see what's going on. Sit up straight. Head down. Guess what? His ears are level now. They're the same size.
All right. Okay. One less thing to get made fun of for. That's fine.
All right. So we did see 7, yeah?
Mm-hmm.
That cleared the top, by the way. So that was compensatory. It's just been there for a while. So there's no pop in your own neck, okay?
Yeah, definitely. Gonna stop that.
I have a video called Flossing for Your Spine.
I've seen it.
Just do that.
I'm definitely gonna do that.
T6 is clear. T6 is clear. Guess what?
Clear.
Yeah. Let's feel now. Now, they're more level. Scoot forward, let's check. Now, here's what's interesting. Because this has been up for so long, dude, and you're messing around with it, you almost got an indentation in the skin from that misalignment, dude.
Oh, wow.
That's what's really, but now watch. Do you feel where my fingers are?
Yeah.
They're both on the bottoms of the PSIS, and if you look, they're level. Okay? Feet together, open and close the knees, please. Open, close, open, close. Left side only, please. Ha, 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 ha. Right side only. You feel the difference there?
Oh, yeah.
What's different?
It's more open. Like, I have more.
Yeah. Left side only? Cool. Scoot back for me, please. Let's test here. And it doesn't mean we're going to need to get to this bottom one at some point, right?
Right.
It may be tomorrow, it may not be. But right now, that's different. How much more or less tender is it here?
Way less tender. Okay, that was pretty tender.
Yeah, but I have to go back pretty far now here. You
Right.
feel that, right?
Oh, yeah.
Okay. We're starting at the pelvis.
Awesome.
Scoot back for me, please. Let's check the motion of the shoulder.
Wow.
We didn't touch the shoulder.
Yeah, it's not snagging as much.
It's not. Just a little tiny bit there. I'm going to set your shoulders.
Okay.
Let's go ahead and set them over, around.
There.
Your shoulder is also coming from your neck, by the way. There. There you go. On your back, face up over here. So we will set the AS talus. There you go. And we've got a tiny bit here too. Dejo?
It's high.
There you go. Okay, let's walk it off, and then I'm gonna check the hand.
That was a face of pain, yes, definitely.
Squeeze. 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 Elbow. Squeeze. 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 Come over here, please. Squeeze. Relax. We have elbow, we have wrist. There. Scaphoid. Scaphoid lunate, squeeze. Good. Squeeze. See the radial, distorsal emerging. Squeeze. Okay.
Whoa.
Turn.
Oh, God. Okay.
It's a real thing.
Ugh.
It's kind of nasty, right?
Yeah.
But it works.
But interesting. Yeah.
Squeeze. Squeeze. All right, you're all set for today. Questions?
No, not really. My goodness, it feels different. Just
How's the rib?
it's not snagging. I can still feel it there. Like
You
when
still feel the rib?
when I move my shoulder blade back,
Alright.
I can feel it.
Come
there.
face down.
Okay.
Check the ribs. Relax the shoulders down. Now, if we are adjusting the rib, it happens on full expiration. That one right there,
Oh,
right there,
Mhm.
or right there?
right there. Yeah.
That one.
Mhm.
Let me just double check it. That's it. Full expiration. Deep breath in. Blow it out fast. There you go.
sore in the morning.
Wind it up.
Forward or back?
Forward.
Okay.
Lots of ice.